More than 30% of U.S. adults are obese right now. While many factors play a role, I will be specifically discussing the role of income inequality in the obesity epidemic. Formerly called the Food Stamp Program, the Supplemental Nutrition Assistance Program, or SNAP for short, was created to provide federal subsidies to buy food for those living at or below poverty. While SNAP benefits vary by household size, net income, and value of assets, the average monthly benefit for a family of 4 in 2018 is $465, which breaks down to only $15.50 a day. So, I went on a trip to Schnucks to figure out how much and what kind of food a family receiving SNAP benefits could purchase. Here are the 3 meals I was able to find that stayed under the $15.50 budget for 4 people. Golden Puff cereal with fat-free skim milk for breakfast, Lewis Bake Shop whole wheat bread with Eckrich bologna and peanut butter sandwich crackers for lunch, and a large case of Chef Boyardee mini ravioli and tomato sauce for dinner. While there definitely are other options available, reflect for a second, and compare the nutrition value of these foods to what you eat in a typical day. Yes, there may be days where I have an unhealthy meal, but financially I have access to an unlimited amount of fresh fruits and vegetables, poultry, and fish. From here, it became evident to me that income definitely plays a role in obesity. Obesity has serious consequences for morbidity and mortality, increasing a person's risk for developing many diseases, such as hypertension, type 2 diabetes, cardiovascular disease, gallbladder disease, and some cancers. While researchers agree that individual factors like genetic susceptibility and behavior are important in long-term weight gain, there is little evidence on environmental influences that impact obesity. Rapid changes in obesity prevalence, though, do point to environmental causes. In 2010, 15.1% of Americans lived in poverty. With the economic downturn, more than 46 million Americans fell into poverty. The CDC analyzed obesity prevalence among adults by household income, based on percentage of the federal poverty level, arranging them into 3 groups: at or below 130%, between 130 and 350%, and at or above 350% of the federal poverty level. During 2011 through 2014, the prevalence of obesity among adults adjusted for age was lowest in the highest income group at 31.2% compared to the other groups, 40.8% for the middle income group and 39% for the lowest income group, both with almost a 10% increase in obesity prevalence compared to the highest income group. Another study by Kate Pickett and colleagues set out to study the effect of income inequality on obesity, with income inequality being the ratio of the income share of the richest 20% of the population to the income share of the poorest 20%. Among developed countries for which data was available, income inequality was sufficiently related to obesity among men and women, diabetes mortality, and average calorie intake. These findings are consistent with studies in the U.S. that have shown associations between state-level income inequality and abdominal weight gain in men, odds of sedentary lifestyles among men and women, and higher BMI among women. With evidence supporting an association between income and obesity, I set out to find what could be responsible for this correlation. So, how is poverty linked to obesity? It has been suggested that individuals living in impoverished regions have poor access to fresh food. Poverty-dense areas are often called food deserts, implying they have decreased access to fresh food. I have seen this firsthand driving through East St. Louis, where the average household income is about $28,000. I would pass small bars and many convenience stores, but never once did I see a grocery store chain like Schnucks, Aldi's, or Walmart. 43% of American households with incomes below the poverty level, which is $21,756, are food insecure, meaning they are uncertain of having or unable to get sufficient food. Therefore, in many poverty-dense areas, people live in hunger and can't access affordable, healthy food, even when they have the money to do so. There is also evidence of an association between poverty and sedentariness, poor health, obesity, diabetes and other metabolic diseases, and premature death. Overall, the poorest counties in the U.S. have the highest rates of sedentariness and obesity. There are multiple reasons that may explain why people living in poor counties are less active. Oftentimes, violence tracks with poverty, which may prevent people from being active outdoors. Additionally, parks and sports facilities are less available to people living in poor counties, and these same people may be less able to afford a gym membership, sports clothing, or exercise equipment. Therefore, while they may be unable to run or walk outdoors because of fear of being put in a dangerous situation, they also may be unable to escape their violent community at a gym because of their financial situation. In 1992, Peter Basiotis, then an adjunct professor at Tiffin University in Ohio with a PhD in economics, hypothesized and confirmed the behavioral model, where household members faced with decreasing incomes first consumed less expensive foods to maintain their energy intakes at a lower cost. To multiple choice questions about food sufficiency, these participants tended to respond, "Enough, but not kinds of foods we want to eat," implying that they had adequate energy intakes but a limited range of food choices. Not until income decreased even more did households reduce dietary energy to intakes below the dietary requirements, resulting in energy deprivation. Basiotis' model, created over 25 years ago, still holds true today. Today, the association between poverty and obesity is mediated, at least in part, by the low cost of energy-dense foods, which then in turn promotes overconsumption. The hypothesis is that energy density and energy costs are inversely linked, such that the selection of energy-dense foods by food insecure or low-income consumers may represent deliberate strategies to save money. People trying to limit food costs are likely to first select less expensive but more energy-dense foods to maintain their dietary energy needs. As food costs decrease further, dietary energy density rises, and total energy intakes may actually increase. These energy-dense foods have become accessible to consumers at very low cost because of developments in both agriculture and food technology. There is a relationship between the energy density of selected foods and their energy costs, as shown in this graph. For example, the energy cost of cookies and potato chips is about 20 cents per megajoule, whereas that of fresh carrots is about 95 cents per megajoule, making carrots almost 5 times more expensive. The energy cost of soft drinks on average is 30 cents per megajoule, whereas that of orange juice from concentrate is 143 cents per megajoule. Fats and oils, refined grains, sugar, potatoes, and beans represent some of the lowest cost options that provide dietary energy at a minimal cost. The hierarchy of food prices is such that dry foods with a stable shelf life are usually less costly per megajoule than our perishable meats or fresh produce. So imagine you're a parent with only $15.50 a day from SNAP to spend on food for your family of 4. You must prevent your family from starving, so you buy the foods that have the highest energy density, costing the least amount per megajoule of energy. However, many of these foods provide little nutritional benefits, but you must eat what you can afford. This is unfortunately the situation that many Americans are currently in. So now that we have some insight into the causes for the association between obesity and income, what are the next steps we take to combat this problem? Potential ways to decrease the prevalence of obesity in poverty-stricken areas include providing free after-school exercise programs and free nutritional programs to students. At WashU, for example, Healthy Humans was created, where pre-medical students teach science and the practice of healthy cooking to students in low-income communities. By providing hands-on cooking lessons with an emphasis on recipes that are affordable and accessible in the community, students and their parents may begin changing their eating habits, purchasing inexpensive foods that meet their energy needs while also providing more nutritional benefits. Additionally, many organizations throughout the country, such as the Boys and Girls Club, allow youth in low-income communities to participate in team and individual sports. By charging only a small fee, usually around $25 to $50, such organizations allow children to engage in physical activity without being in potential harm. By implementing such programs, we can teach that anyone can be healthy and active, regardless of their financial situation. By increasing accessibility to such programs, I hope that one day poverty will not serve as a risk factor for developing obesity.